Hi, welcome. My name is Brian Bezic. I'm a PA. I practice in pulmonary medicine just outside of Boise, Idaho for the Terry Riley Health Centers. We've been looking at COPD in this micro-learning video series. This next part, I do want to delve into the treatable traits a little bit. When it comes to COPD, once we have the diagnosis, which requires PFTs or spirometry, we can then examine the phenotype, asking whether or not the patient has type 2 or eosinophilic-driven inflammation playing a role. Now, if you think back not that long ago, if you were practicing, you may remember that we used to treat COPD based on stages. We would test the patient and give them a stage, a COPD stage. That then determined what inhaler they got. Stage 3 might get this inhaler, stage 4 this inhaler. The problem with that was there wasn't a good correlation between the stages and outcomes. How is my patient? What can they do day to day? Can they go shopping or not? Are they able to breathe well enough to sleep? Those did not correlate well with stages. So we changed that. Gold turned that upside down and asked the question, how are you? Tell me about your symptoms right now. What can you do day to day? Are you okay doing laundry or not? The second part is, how have you been? How sick have you been this year? Have you had more than one exacerbation? Has it been severe? Were you hospitalized? Based on the how you're doing and how you've been, we can decide a much better algorithm for treating patients with COPD. Now, when it comes to the how you're doing, there is a one-question test called the MMRC. This is a one-question test that gives you a score between 0 and 4. A 3 and 4 indicates greater symptoms, and 0, 1, or 2, less symptoms. On the GOLD guidelines, you'll see a treatment algorithm with the letters A, B, and E. A and B correlate to those patients with either mild or moderate to severe symptoms, A and B respectively, but have not had significant exacerbations. In fact, 0 or 1 exacerbation in the last year, and that one could not have been severe or requiring hospitalization. For categories A and B, we start with either 1 or 2 bronchodilators. For those patients in category E, we also want to use dual bronchodilator therapy. But there's a caveat. For those patients in category E that have elevated eosinophils, 300 or above, consider using an inhaled corticosteroid from the start, or advancing therapy to include an inhaled corticosteroid or a triple inhaler. Again, that's this treatable trait idea, this phenotype of eosinophilic COPD, and using steroids because they tend to be more effective. If you have a chance, look over the GOLD guidelines and the category A, B, and E treatment algorithms. It'll help you know how to initiate and advance therapy for our patients with COPD. One more video, and this one we're going to talk a little bit more about advancements in the treatment of COPD, specifically regarding exacerbation, prevention, and what new therapies we have that can impact our patients' lives.